Now, how do patients, and I'm going to need some of these. Now, I'm just going to show you some extra exams. I'm going to throw them in. If I'm going to do facial nerve, which you're going to do for me for midterm, then I'm going to use this. And I have a sequence, don't I? So we did one exercise by how do you create a differential and how do you tailor your questions. Now I'm going to show you how do you do the complete head, neck, ear exam, okay? Now I'm focusing on the midterm content. So we actually did two things. The reason is that you're going to have a PBL to do today for me, which is actually pretty easy. Now this is for my facial nerve. This is going to be for the throat exam when I get there. And to do the ear, what's the one piece of equipment I need? I need an ear cone, don't I? Now, if I was going to do the nose, I would want an ear cone too. Could you look over in that right-hand drawer? Let's see if we have some ear cones. Ear cones! Good! Now notice what I do here. Face, ear, nose, mouth. Looks corny, really corny, but boy, if you do this during your exam for me, you're going to be real happy. Now, next week, what happens between the ear and the face? The eye. Now, what are we going to use for the eye? Well, first of all, we want to have that little Jaeger card. Okay, and if you, we'll get to that in a minute. Okay, now, we're going to need a 3x5 card or a card to line the eye, and beyond that, you don't need too much. Okay, so, now I'm going to do Ross front hands, and glove up. No, don't do that, please. All right. Now, I'm focusing just on the head. Okay, now the head is normal cephalic. Okay, no lumps or bumps. Now, okay, the temporal arteries are +2 out of 4. Now, can you smile? Thanks. All right, now, move the jaw from side to side and then open and shut. Okay, there is bilateral crepitus. Now, let's clench your jaw. Okay, great. So, motor cranial nerve 5 is intact. There's bilateral strength. Now, this is sharp, and this is soft. Now, I want you to shut your eyes and tell me what you feel and where.
Sharp on my hand.
Okay, good.
Soft on my cheek, my right cheek.
Okay.
Sharp on my right jaw.
That was tricky. Midline.
Sharp.
Okay, so cranial nerve 5 sensors intact because she's able to recognize the differentiate the difference between sharp and soft. Perfect. Okay, so we've got cranial nerve 7's intact because facial symmetry is present, and we did cranial nerve 5. Okay, well, now next, remember, we would be doing the ear, but we'll fill in with the eyes, so that's where I'm going to go next. So that was the head. Actually, why don't I throw in the sinus pressure, because we could do that as part of the head exam, because a lot of people do this as part of the nose exam, but you can do it now, okay? So we actually palpate. Some people do it with their thumbs over the sinuses, so frontal sinuses, maxillary sinuses, okay? Now, there's a cute little test, which is called illumination, trans illumination. Now, notice how it helps if the lights are on. Here we go. Now, notice how she lights up. See that nice sunset? Okay, now I don't want to see how that works.
Yeah.
Now, if she has an effusion in the sinuses, she's not going to light up. See how that looks? That's pretty neat. So you have
So it'll be dark, you mean? Or like,
it would be dark, yes.
Okay.
Or it wouldn't be like the 180-degree illumination.
Glow,
Yeah. And actually, that's a pretty good test. Okay. Now I'm ready for my ear. Now, what I'd like you to do for safety's sake, for the little people, since they move around, is hold the handle up and then take a hold of that tube so you're the master of the tube. Does anybody see a problem here? I'm short and she's tall. So that's what my patients do, but maybe we'll have to get up on tippy toes. But in any event,
Could I lay down?
that could work if you're a child, but we'll make this work. The ear is inserted at a 15-degree angle. There's no abnormality in size. There are no lesions. Now I'm moving to palpation. I'm checking for tenderness. And
Ow!
there's no tenderness. Okay, I like drama. This is the fun with adults. Okay, now come over here so you can really see how I do this. Now I'm going to pick up the ear like this, and then I'm going to look and make sure I can see my way in. Okay, so this is what I see. Now you have an interesting ear. Very interesting ear.
Really?
Yeah, you do. Okay, so I see my landmarks against a grayish membrane, and I see my malleus at 10 and my angle of light right on the dot at 7. Now, do you have allergies?
No.
And she has a definite opacity in the posterior quadrants. Now, let's just for the fun of it, let's look at the right. Now, did you see that I had the instrument in my left hand for the left ear? Now, instrument goes to the right hand if it's the right ear. Now, tympanic membrane is quite opaque.
Really?
Yeah. And your landmarks are at 2 and 5. The angle of light's visible, but it's slightly diffuse. Actually, you've had an infection within the last 6 weeks.
Yeah, I have actually.
Yeah. And that's why the right drum tympanic membrane is opacified. The grayness is actually seen from 1 o'clock all the way over to about 4 o'clock. So your partner's going to have some excitement.
Woohoo!
Okay. Woohoo. Okay, now, here's your personal cone.
Thank you.
Thank you. You're welcome. I think it's like that. Now I'm going to do the whisper test. Now we know to do the whisper test, you need to get behind the person. We need to distract the ear by pushing in and out. And
The other side, you mean? No.
exactly. And then I'm going to whisper.
Martha May.
Even I can do that. Okay. So the whisper test is positive. Okay, so now let's do the neck. Now, first of all, the neck is hyperpigmented and symmetrical.
I know, it's old lady skin.
No. It's good. It's good. Okay, so the trachea looks like it's midline, and I don't see any masses that are obvious. Now I'm going to go to palpation. Okay, now the trachea is midline. The carotids are plus 3 out of 4. Swallow, please. Good. Now tilt your head to the left, to the right. Okay, now I definitely feel a little enlargement here. Not much though. Okay, good. So she has slight enlargement of the right lobe, but there's really no thyroid megaly, and there are no discrete nodules that I can feel.
They couldn't find it on ultrasound either.
Okay, well, you see, that's good. Okay. So what I like to do now is generally like the lymph nodes. Okay, because I'm going to show you how to do the JVD as part of this exam. Because I'm preparing you for cardiac. Okay, so submental, submandibular, jugular digastric, preauricular, postauricular, occipital. Now, superficial, cervical. Now here are the tricks. Okay, see that soft? Now look how I pick up a muscle. See how it bulges up? Look at this. Pick it up. and then feel it. Now you can feel me going under your muscle, can't you? That's how you do the deep cervical chain. Now the posterior cervical chain, I know, is right here. The supraclavicular and infraclavicular show nothing, so no lymphadenopathy.
So even though you could tell that I'd had an infection, the lymph nodes are all there.
Now, especially through the sweater. Now, what I could have done, I can do it now or later, but it's best if you start it out, let's start out the exam, because actually range of motion is inspection. So nod forward, side rotation, touch each ear to your shoulder, great. Now, could you shrug your shoulders? So cranial nerve, what is intact? 11, bilateral shoulder shrug, push your head. Now it's actually turning your head, so she turns her head. Because isn't it these muscles that turn the head?
Yeah.
Okay, so her cranial nerve 11 also is intact because of bilaterally strong resistance. Okay, now that was nice. Now I'm going to do the JVD, okay? Now, we start out with a person in a 90-degree angle. Now, we, unfortunately, as clinicians, and it's not just nursing, just about everybody goes by the external jugular, but actually that's not really correct, because the external jugular can fill up when you Valsalva. Pain, anxiety, laughing could make us look like we've got heart failure. That's ridiculous. Can you just do a little party trick for us?
Sure.
Okay, thanks. Now, push down and do a little Valsalva. And you see how the vein fills up? Mm-hmm. That's why this is see that? It's all the way up to the jaw. Now let go. That's not comfortable, I know. I really know that. She had JVD all the way to the jaw. So we don't like that. So let me show you the anatomy. I like that. Now, when a patient's on a bed, they have to make sure that those legs are supported. Now, we're going to look at the leg tangentially.
Oh, sorry.
Now, in a 45-degree position, most of us can see the external jugular. Now, how do we find that? We look at the angle of the jaw, and then we're going to look for a line that actually points to the midpoint of the clavicle. See this? Mm-hmm. Now, notice that the column of blood stops here. And you see how it ripples? That actually associates, well, you can't from there.
Right.
But if you get behind me, there's space for you. Come on, both of you.
Oh, yeah, it does.
Now, the ripples are associated, by the way, with A, C, and V waves. The A wave is atrial contraction.
Oh, yeah.
The C wave is the valve closure. And the V wave is going to be the big ripple, and that's ventricular contraction, okay? So this ripples, the arterial pulse just goes boom, 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 right? Big difference. Okay, so that's the external jugular. Now, how do we measure it? What we're going to do is we're going to take a straight edge with a measuring surface, a ruler. Could you do me a favor and get me one of the little rulers in the...
It could be,
There's no ruler?
We have to take measures.
Okay, well, I guess that'll have to do.
Could you use a pen?
Yeah, we could use just a card or something like that, but in any event, what we do is we go to the sternal angle.
How about this one?
Okay, we go to the sternal angle, and we take our little ruler, and we raise a straight line. Now, the height of the column is measured this way. Now, she did a Valsalva, and let's just say she has heart failure. It came up here. So if we took that over in a straight line, the intersection's here. Now, we would measure the height of this column. That turns out that anything over 2, in other words, 3, 4, 5, that's positive JVD. So you see, that's not that hard. But remember that if the patient's in pain, you may, get a bad number.
Does it have to be supine or semi-powders are okay?
It's got to be 45 degrees.
45
Now,
degrees.
some people do it in 30, but if you measure, you've got to report it that it was done at 30.
At 30.
Now, let me show you what you really should be measuring off of. Okay, the internal jugular is right here, this little pocket. Now, right there.
Okay.
Now, I just want to point out right below the tip, do you see the rippling? Right there. That's the internal jugular. Now, if this person really had heart failure, that would be elevated. Now, that's not easy to measure off of. That's why most people go for the external jugular. But I just wanted to point out the difference. Okay, now, if somebody has jugular venous distension and it's real at 90 degrees and it's left heart failure, what pulmonary findings would we expect? Crackles, of course.
Right.
Remember the hearts? Now, if they have right heart failure, are we going to get crackles?
No.
No, you might get other lung findings like wheezes. Okay, so now what you're going to do in the next 15 minutes is you're going to practice yourselves now, and you're going to get the rhythm down. Now, I want you to actually do it in the order that we've discussed. The only change or change I would make is, why don't you start out with the range of motion as part of your inspection of the neck. That'll make it a little bit smoother. And then that's what we're going to keep for midterm practical, okay? Now, remember, I didn't say a lot of, I'm going to do this, I'm going to do that. That's a waste of time. I just want to know your findings.
Let me ask you a question.
Yes.
One of the things you showed us was the tongue movement you were doing for that one of the nerves.
Okay, that is going to be when we pick
Okay,
up the
awesome.
mouth.
Okay.
I just introduced all the cranial nerves today because, I mean, I don't want to get to next week and not have you know them all.
Right. No, what I'm saying is that if a person is able to speak very clearly, would you necessarily do that? I mean, it seems like.
Well, the thing is that
I mean,
probably.
is there like indications for some
Okay,
physical?
yeah,
That's what I'm
exactly. That's a good, actually, I like that question because you're talking about what's appropriate.
Right.
Because you don't want to waste time, right? Doing something that's not necessary. Now, a lot of you are going to start out with complete physical exams,
Right.
so then it's necessary.
Of course.
But if they can speak clearly and articulate, if you just ask them, do you have trouble swallowing, then you can get into the other stuff.
Right.
But if they articulate, you need your tongue to do that. So that's a good observation. Then you can forget the cranial nerve exam. But right now, I'm just
Well, yeah,
showing you
right. Obviously,
your
yeah.
repertoire. Now, for instance, if you're a musician, you play lots of different types of music, but you don't play it all at the same time.
Right.
You pick and choose what you need or your audience. Okay, so let's get started. Now, meanwhile, I'm going to be out of the room preparing your PBL.